Those are both very interesting. How you're describing it too, it reads almost like one of those clinical pearls, or a clinical case, right? Of, hey, you've got this a patient with small bowel obstruction. That's exactly what I was just thinking of. Where is that going to go? Where are those products going to end up? If you've got cut off, it's going somewhere. So and hopefully not directed towards you. And like the same thing with the bloody airways. It's always, as a doc, that's my biggest fear, right? And especially with the video laryngoscopes, because a lot of we don't have accessibility to the fiber optics. You mentioned that, and see your algorithm for difficult airways. It's becoming more and more prevalent, but I still like I've covered in hospitals that don't even have laryngoscopes at all. So the video scope. So it's like those things are quite a harrowing experience. You've got that, the angioedemas, right? Those things that can really turn into a surgical airway and just a complete disaster. So very interesting. You mentioned in that too about the LMAs. The supraglottic airways are kind of an interesting point. In my training as a medic in the Army, that was all the fuss was like the King LTs. There's been a lot that I've seen personally that I think that there was the Airways 2 trial that came out in 2018, I believe, and it was really pushing folks to do that in the pre-hospital environment. Somehow that became eye gels for everybody. And I think it's been a massive disservice to the public. Now that paper's been called into question multiple times. I can say from numerous accounts coming in from the folks that have had an SGA placed, an eye gel in off to the side. They've been undergoing cardiac arrest, these resuscitative efforts for 40 minutes, but the entire time, just like nothing is, they're not oxygenating anything, right? So they're just circulating blood for what, to what end. There's been times too where I've removed that, and like you said, looking for obstructions like blood clots, vomit, blood. Products, there's been weird stuff that we've pulled out, and boom, right, you get somebody back. But I'm curious from your perspective too, it seems that the pendulum is starting to swing from the pre-hospital side of establishing airways early versus placing that supraglottic. But in the OR, I know it's like something too that's, I guess, for certain cases. But just from your perspective, like, what do you think as an anesthesiologist? I mean, for folks that are in the pre-hospital environment, do you see that going into the right direction? Do you feel the SGAs were more of like a better call, or what's your opinion on that?
I think, to be honest with you, we use them in the outpatient setting in the operating room predominantly just for cases that don't provide paralysis and generally tend to be patients with a better body habitus. So I think it's going to be a quicker case because it's less invasive than getting an endotracheal tube in your oropharynx and into your throat. That being said, I do think in the emergency setting, it's always better to innovate and to place an endotracheal tube in the patient just for airway protection's sake, and because sometimes the LMAs don't seat accordingly, so you can lose tidal volume. And I can only imagine in the emergency setting, it would be difficult to make sure you're ventilating appropriately with an appropriate seal with an LMA. So I think it would be more used as an emergent airway type of thing if you're unable to innovate, just as an emergency backup if all else fails.
Yeah, there was I had a case once. There was somebody that was still in Coumadin. They were extremely like super therapeutic. IRNR was like 10 or 11 or something crazy. But they had sustained this traumatic injury. There was a fall, and there was something going on within the mouth. Anyways, they rolled up, and it was the same deal that somebody had placed a supraglottic because the patient became kind of tentative, just a little confused, and then slowly just began to kind of go downhill. But I remember pulling this LME out, and there was just this massive, just like baseball sized clot, inside, and they were trying to, bagging the whole time. But extreme examples, but they kind of illustrate points and things that I always think about, like from that area and that perspective of like where things move.